Between September 13th and the 25th, the Healthy Heart Foundation and its partners, the VUM Foundation and Afe Babalola University, funded and performed 13 open heart surgeries for patients who could not afford it. Open heart surgery is one of the most expensive surgeries in the world, and there are very few surgeons and practices that are equipped for it here in Nigeria. Arise News has been covering the foundation's journey over the past few days. Our correspondent, Layla Johnson-Salami, sends in this final report on the last day of surgery at First Cardiology Consultants Hospital.
It's the final day of sponsored open heart surgeries by the Healthy Heart Foundation and its partners. Odunayo is a 35-year-old lady with a hole in her heart, and she's getting ready for what is expected to be a life-changing day.
Actually, I'm trusting God that after the surgery, I'll come out more stronger than before. As I wish to be back to my real self I used to be. I am a teacher, I love teaching, and I have passion for the job. So I wish to still take more time with my students in class and enjoy ourselves.
Performing her surgery is Dr. Bode Falashe, a cardiothoracic surgeon with the Lagos State University Teaching Hospital.
The hole in the heart is essentially a defect between the top chambers of the heart. It's called an ASD, an atrial septal defect. So blood is shunting from the left heart to the right heart. I've known this young lady for the last 2 years. She's been raising money. Thanks to First Cardiology and VUM Foundation, she now has a chance to get her surgery done free. Once it's done free, all her symptoms should disappear, and she should have a normal quality of life. Touch wood.
Over the course of the past 12 days, there have been 13 open heart surgeries here at First Cardiology Consultants Hospital. Ms. Angela Nwaneri is the Chief Operating Officer of the hospital and a board trustee for the foundation. She spoke on the achievements here over the last few days.
I came into the hospital one day and sitting all the way in front of the hospital were patients that normally wouldn't be the profile at First Cardiology. And I just kept thinking the fact that many of those people would normally not get this, right, without a project like this. And I'm wondering how many of them will be alive by the end of the year if they didn't get this opportunity. So my measure of success is that if I can get one of those patients, give them a lease on life that they wouldn't otherwise have, for me it's been a fantastically successful event. But to answer your question directly, I think we've had 13 of this so far, and we've lost one patient. So obviously, any life is too much to lose, right? But if you're just measuring statistically, we've had a pretty good success rate.
The Healthy Heart Foundation is looking to continue providing open heart surgeries for patients who cannot afford it as often as possible from now on.
We will do this on an ongoing basis, but we also know that's not sustainable, it's not feasible. But if we can do it 3 times a year or even quarterly, that'd be fantastic, right? I know there have been conversations about doing it maybe once a year, but I do think that if the response rate we got, Healthy Heart Foundation, when Dr. Johnson sent out his SOS for assistance, for help, people have been absolutely, absolutely amazing. Actually, it shocked me how amazing people have been in their response. So with that kind of a response, if we keep getting that kind of a response, I don't think there's any reason why we can't do this at least quarterly. So hopefully by the end of this year, I'm hoping that we can do one in December, and it will be a wonderful Christmas present for one family at least out there.
And there are certainly challenges beyond the foundation's control that it will face and is already facing. Cynthia Egbai, the practice manager and administrator for both the hospital and the foundation, explained some of the hurdles.
One instance I've had with all of this was this patient from Katsina State. It literally took me over 3 weeks to get to her, and eventually when she did arrive after over 2 days of travel, it was a case of she had been in this part of Katsina where the server had been cut off, so there was no communication, they couldn't make calls. On an arrival, unfortunately, she hadn't been taking her medications, obviously again being cut off from all the supplies that she needed. So will definitely require much level optimization before she could go ahead and have her surgery. It's just been situations like that, just being unable to get through to the patients now that you even have some level of support from the VOOM Foundation, and then not being able to get to them. I live in Lagos, so I would say we don't know the half of what exactly is going on in the country, because in Lagos it's similarly smooth, you're going through everything, but these guys are actually going through a lot. They don't have medication, the healthcare is almost zero, to say this, and it's just a lot. For me personally, the patient I'm referring to is younger than I am, so I say, like, how do we get to this point and how do we get out of it? Because she's a mom, she's struggling for her life with a new baby, and it's terrible.
Open heart surgery in Nigeria is still taking baby steps, although the first one was performed in 1974. With few institutions for cardiac surgeons to practice and perform in, there are simply a handful of people doing the job across the country. And now the plan is to ensure that this care becomes more accessible, with the hope of eventually increasing the domestic capacity to perform open heart surgeries in the country on a routine basis. Leila Johnson-Salami, Arise News, Lagos.
Now, to shed more light on this worthy project, we're now being joined by none other than Dr. Adeyemi Sanyade-Johnson, who is the Medical Director and Chief Executive Officer of First Cardiology Consultants Hospital. Welcome to the program this afternoon, sir.
Honestly, welcome. Thank you very much for joining us today.
Yes, that was a very touching
Yes, it was.
piece of video that we were watching. It seems like you're changing lives and doing the good Lord's work for a lot of families out there who can't afford it. Can you please just tell us how the experience has been for you, and now that it's coming to a close, what you feel about it?
Okay, well, this has been a very interesting experience for me personally. Now, I don't want to by any means take the credit for all of this that happened. It wasn't just me, no. It was everybody that joined in together to get this thing done. But it's a nice feeling helping people who seem like they had no hope. It makes you feel good. But at the same time, it has exposed me to the hardship many people have to go through. It's heartbreaking. It's heartbreaking. And now these were adults. We have the babies. We didn't deal with the babies this time. We hope we will work on them next time. But there's a lot of heart disease and the people cannot afford their medications. They can't afford to come to the clinic. It's heartbreaking. And I was happy, but then today I started feeling funny that, okay, so after today, what happens to these people? And I did some calculations in my mind here. Nigeria last year did about 120 open heart surgeries. Sudan does an average of 1,500. Ghana does 1,000 a year. Kenya does about 1,000 a year. These are all countries whose populations are probably the size of Lagos, but they're doing more. And I went to find out why are they able to do more. It's not that we don't have the cases. We have people who need the cases. Now, in Ghana, there's a health foundation that subsidizes Ghanaians 50%, all right, of any surgery. So they subsidize. And the foundation is run by former central bank governors, bankers, businessmen. And they choose who they support. And sometimes the patients get completely free surgery. And Kenya has health insurance, all right. Sudan, it is subsidized by the government. Now, in Nigeria, right now, we're going through some bad times with the economy and all that. So I don't think the government can actually support all of these things right now. But then we thought about this foundation and said, okay, what will it take? So we said, let's start our foundation, at least start to help a few people. But then when you work it out, maybe surgery would cost about an average 5 million naira per person. It's expensive, mostly due to the fact we have to buy everything from abroad, everything from abroad. So it's expensive. Okay, so 50 patients, that would be 500 million naira, if my math is correct. Okay, 1,000 patients would be I think that was 1 billion naira, something like that. Anyway, for 1,000 patients, we would need $10 million. For a country this size, that's not too much to ask. So my next mission or my next plan is to see how we can raise that kind of money and help a lot more people. Because it is sad. It is sad what's going on out there.
I was about to ask a question on how to, probably maybe you should enlighten us on the processes, how do you prep for surgeries? But since you've started on this line, let's actually stick to that. Because seeing this happen, first of all, I must say, huge commendation to you, your team, the VOOM Foundation, and everyone who is involved in this. But we still see government officials spend millions of dollars on medical tourism. So when you come out and you're speaking and saying that this is how much it costs to actually help people, in Nigeria, what you're giving us, what you're giving out there, is it almost on par with what you can get probably maybe in India or maybe in Thailand or something?
Okay, well, let's go back a bit. When you go abroad, especially to the US or the UK, you find out that it's a Nigerian doctor that's going to treat you. All right? We have the people all over the world. Just many of them can't come back because we don't have the infrastructure, nowhere for them to work. All right? I came back partly because my kids already gone through school, so my financial obligations were not that heavy. And my ambition was bring cardiology to the level we're used to working at in the US. So I can tell you that there's several hospitals in Nigeria now that perform open heart surgery, perform other procedures like hip transplants, knee transplants at the same level you get in the US or in the UK.
So that means it's even higher than what you even get.
No, we have the people here. They're in, you've got to know where to go, but we have all these things here.
Wow.
We do kidney transplants, not us, not me, but we do kidney transplants. When I say we, I mean Nigeria. Kidney transplants are done here. Only thing in cardiology that we can't do here right now is a heart transplant. Most other things we can do.
Wow.
All right. Now, COVID, funny enough, helped us.
Okay.
In a odd sort of way. Because there was a lockdown, you couldn't go to India, you couldn't go to the UK. Our people were stuck with us. And I think they were pleasantly surprised to find that the expertise was here. Expertise is here. We all need help because we run a private institution. It's difficult to get money. The margins are so marginal. People think we're making a lot of money, but the revenue is large, but there's zero profit.
Wow.
We look in our books, we haven't made profit one time since I've been back in 10 years or 12 now. Not one time we've made profit. So it's really not a profitable business, but we all need help. Luckily, CBN gave healthcare some intervention last year. We've taken advantage of it. We're able to buy some more equipment and try and expand our services. So the government is doing their bit, the way I see it. We can do a lot more. Yes, a lot of money is taken abroad, sent abroad. I mean, it's spent abroad for healthcare, but people are beginning to realize it is here. And I think the more Nigerians that patronize local healthcare, the better we get. And the services become more efficient. And then you can now, once you have efficient services, you've got more people doing this thing, then you can be able to treat people who don't have money. And it's important. If we don't treat people who can't afford it, then we're not really doing what we should do.
So we have the expertise here in Nigeria.
Yes.
We have the surgeons, we have the equipment.
Yes.
We have the need.
Yes.
What are the challenges apart from the financial bit?
I don't want to get in trouble on air, but I will say a few things. The biggest challenge for us, I think, in my opinion, is bringing in medical equipment and consumables. It is very difficult. Very, very difficult. Apart from expense, then you got to go through customs. Then you got to go through NAFDAC. Then you've got to go through, I think it's SONCAP.
Even in these times of COVID-19 and the worldwide
It is
pandemic?
very difficult because the amount of paperwork you have to provide to prove you're not trying to, like in some instances, you bring in operating theater lights. If you do not do the paperwork tight, customs will call it a chandelier. Then you got to pay this sort of thing. So without trying to get into trouble, some of the policies and agencies the government has in place seem to be counterproductive. And that's one thing I hope we can eventually sort out, because it is difficult to bring in equipment here. The VOOM Foundation, who brought in stuff, the amount of paperwork and bureaucracy they had to go through to bring in equipment, it's mind-boggling. It is. And still, some got seized at the airport because I's weren't dotted and things like that.
Wow. So now let's come to the nitty-gritty. How long does it take to prep for surgery? How long does it take to prep a patient? How long do doctors like you need to prep for surgery? And talk to us about rehabilitating them and recuperation, basically.
Well, it depends on what you mean by prep. Because in medicine, we have prep, which means preparing the patient on the operating room table. I don't know if that's what you mean.
Oh, prep before.
Okay.
Before you get
it all depends on what the problem is. It all depends. There's something called interventional cardiology. Prepping the patient, that's where we put in stents.
Okay.
All right, without cutting you open. That's what I do. So prepping the patient just means you make your diagnosis. That doesn't take long. We have all the equipment. We make the diagnosis, tell you need a stent. Tell you to come in that morning. And we put in the stents through the arteries. And the procedure lasts about an hour. And you go home the next day. So for stents. Open heart surgery is a little bit more extensive. You've got to come in at least 2 days before surgery. We've got to check your lab work, make sure everything is okay. So we predict any potential complications. And the surgery takes anything from 4 to 12 hours, depending on what it is. And then recovery is anything from 4 to 2 weeks, depending on the kind of surgery.
And the surgery gets rid of the symptoms that are plaguing the patient. Let's talk more about what the causes of these heart diseases are. I have 2 questions. So more the causes of heart issues, are they preventable? And second of all, are these surgeries open to children? We know we've had success rates with the adults, but children also have, I'm assuming, these heart issues as well. Would that be something that is done on them?
You know, I'm getting old now, I forget the questions, but let me start with it cures the symptoms. It does a lot more than that. It prolongs life. Many of these people would die within a few years if they didn't have surgery, and they have been dying because they haven't had access. So that's one. 2, what causes them? There are 2 types, I would put, acquired and congenital. Now, congenital you're born with. There's pretty much not much you can do to prevent that. Acquired, 90% of the heart attacks I have seen are preventable. And it's simple things. Your diet, smoking, exercising, watching your blood pressure, managing your blood pressure, your cholesterol, all these things you can control. Diabetes you can control. And you just have to do what you need to do. Many people don't realize they have hypertension, diabetes, and they come up with a heart attack, and which is very preventable. Now, children was the next one.
Yes.
Yes. We operate on children, all right? But the VOOM Foundation and us this time around, first time we've partnered, said let's concentrate on the adults first, all right? That's what we're used to doing most of the time. We have pediatric cardiac surgeons. So next time around, we're going to work it out. And it is important to treat the kids. They're the future of the country. So we will get to them. But we can't do it on our own. We need help. And like I said, 1,000 surgeries would be, what, $10 million. That's not too much for us to fight. It isn't.
All right, because we hear that there is a committee being set up, being led by the Vice President of Nigeria, talking about Professor Adeyemi Sanyade-Johnson, trying to bring reforms to this health sector. What do you think that would probably solve some of these problems we're speaking about right now?
I don't know the answer to that. I really do not know the answer to that. We have had many such committees in the past, and they came up with brilliant suggestions. They just were never implemented.
Wow. Okay.
In previous governments and all that, we've done it many times. If this is implemented, it's going to work out. But the question is implementation, and as it usually happens, the committee will meet, they come up with recommendations towards the end of this administration, and then the next government will not take it over. That's what frequently happens. So if they can come up with recommendations quickly, we get out of this recession, although we're officially out of recession, the government has some money to implement the policies, it will work.
But I look at the health sector, people have complained that it's underfunded. What can we do? What do we need to do as citizens on our own part to probably ensure that the government understands that, as they say, health is wealth?
That's a political question. Yes, healthcare is underfunded. Most of the progress going on in healthcare is going on in the private hospitals. Most of the progress. It should be in the government hospitals, but the government bureaucracy is holding back a lot of progress. Bureaucracy is one thing. So that's all I can say on that. I do not want to get into trouble.
I understand.
And speaking
Completely understand.
of bureaucracy, I know that the country is going through a bit with our own doctors. You know, there's lots of strikes.
True.
They are upset about a lot of things that have not been implemented for years, just as you have spoken on. Can you speak on the mental health of doctors and first responders, people who are actually taking people's lives and trying to keep them alive? Can you just speak on what that does to you on a daily basis, and those who are in your line of work, just so people can empathize and really understand the shoes that you are standing in?
Okay, I can talk a bit on that. Like during the COVID pandemic, for instance, we had a COVID ICU. It has been the most traumatic experience of my life. It was terrible. And all of us who took care of COVID had PTSD, all of us. All of us. We had to get psychological help. And Lagos State actually did provide that. It's one of the reasons why we didn't want to go back into it. All the doctors said, no, they can't handle it. Now that's us in COVID. Now the people who take care of these patients, 2 days ago, I listened to a doctor from Maiduguri. We have a Nigerian Cardiac Society meeting going on now, conference. And he gave a rundown of what they have to deal with in Maiduguri. And that's when I realized in Lagos we don't have problems. So you can imagine the anguish those people go through. You know what to do, you can't do it.
But is it understandable? Because it's almost, for you, it's almost the other way around. Instead of probably trying to get out of Nigeria, you have returned to Nigeria. But do you understand how these people who will practice here in Nigeria feel when they say they cannot handle this pressure anymore and they just want to?
Oh, I understand. I understand.
Is it relatable?
Is it
relatable to you?
Yes. I left. So
that answers the question.
Yes, I left. Things weren't that bad in my time.
Okay.
I left. Most of my colleagues didn't leave. Maybe about 10% of us left. Many of us have come back. Now it's a bit more difficult. You graduate from medical school, then you now have a hard time getting a job as a doctor. You actually have a hard time getting a job.
Wow.
Yes, even housemanship, even youth corps. It's complicated. So I don't blame these kids for going out, you know, and then they'll come back better trained. Right now, I don't begrudge anybody who goes out. They've got to do something. It's hard. Life is hard for a young doctor or a nurse these days. It's not just the medical thing. Life is hard. If you live in Lagos, 3 hours to get to work, 3 hours to get back. It's not a sustainable way of life. So I don't blame them. And hopefully things will improve and they start coming back. But at the same time, that just shows you what the Western world thinks of us. They are stealing our talent. But they talk every day about how useless we are, you know. But they're taking all our doctors. They're taking all our nurses. But you know, the Western world is not here to help us. They are not. England, US, all these countries, it's all lip service. They are pretty much doing what they did during the slave trade. They're stealing all our property. That's what they're doing. And they're paying them, they're not paying them the same salaries they pay themselves. So it's cheap labor for them. It's the same thing all over again. So as far as I'm concerned, we have to help ourselves.
Yeah, we definitely
We have to help ourselves. We cannot rely on anybody to help us
So
out.
it's not all rosy for those doctors that actually move that way?
No, it's better. It's a better life than what they have here now, but they're not. There's a glass ceiling they're not going to cross.
Yeah.
There is.
Oh, we could talk about this for so much longer, but Dr.
Yes.
Sanyade-Johnson, thank you so much for
Thank you very
coming
much for your time.
this afternoon.
Lovely.
And all the best with your efforts.
Thank you.